What happens when there are disruptions in normal processing within hemispheres? Some of the earliest findings about lateralization of function came from purposeful disruption, independently anesthetizing the left and right hemispheres prior to surgery. The intent was to examine where critical functions, such as language, were located, so that the surgical procedures to alleviate epileptic seizures could be performed more safely. Some of the most dedicated work on lateralization of function has come from the lab of Michael Gazzaniga. His early research used animals to examine the effects of severing the corpus callosum. By dramatically restricting communication between hemispheres, he was able to explore how animals responded to different experimental scenarios. If an animal was classically conditioned to respond to a certain stimulus by presenting that stimulus to one visual field, therefore one hemisphere, would the animal know how to respond if the stimulus was presented to the other visual field? Or was that knowledge trapped in the original hemisphere? Gazzaniga's research later extended to human subjects who had undergone split brain operations. Split brain surgery is a drastic way of alleviating epileptic seizures and involves severing the corpus callosum, thereby restricting seizures to one hemisphere and, for some reason, also reducing seizure frequency. By cutting the main bond between the brain's left and right hemispheres, the two hemispheres do not exchange information as efficiently as before. The effects of this surgery are not as profound as one might imagine, but Gazzaniga has found a number of interesting changes. When two items are flashed to the left and right visual field, the patients can simultaneously draw them with the contralateral hands. Drawing two different objects is hard for intact brain people to do at the same time. But if you flash two objects and ask the patient to name what he saw, he will only be able to report what was flashed to the right visual field and ended up in his left language processing hemisphere. It's not that he's unable to vocalize what was presented to his right hemisphere. He appears to have no conscious recollection of having seen anything on the left side of the screen. While not available to consciousness, it's there. If he's now asked to try and draw what might have been presented, he can. It might take him a moment to guess what it is that he's drawing, and it still won't generate the conscious notion of having seen it previously, but he'll draw it. The same is true if you ask the patient to select one object with his left hand from an assortment of objects. He'll be able to select the correct object, the one previously presented to his right hemisphere. For some patients, this independent processing can cause problems. Some may experience anarchic hand, where one hand seems to have a mind of its own, clumsily battling one's conscious volitional actions. People born without corpus callosum don't behave in the same way as people who undergo split brain operations. The corpus callosum is one of many commissures, and although it certainly overshadows all the others in terms of its size, the other commissures in those born without corpus callosum appear to be more developed. These individuals, for example, can verbally describe what they feel in either hand. Splitting the hemispheres is one thing, but what would happen if we lost one of our hemispheres? The answer to this can be seen in patients who have undergone a hemispherectomy, and it demonstrates the remarkable plasticity of the brain. This is the MRI of a 7-year-old girl who had had a hemispherectomy at the age of 3 for Rasmussen syndrome, an autoimmune disease of the brain. Intractable epilepsy had already led to right-sided hemiplegia, paralysis, and severe regression of language skills. Though the dominant hemisphere was removed, with its language centers and the motor control for the left side of the body, the child is now fully bilingual in Turkish and Dutch. Even her hemiplegia has partially recovered and is only noticeable by a slight spasticity of her left arm and leg. She leads an otherwise normal life. Hemi-neglect, also known as unilateral neglect, hemispatial neglect, or spatial neglect, is a condition in which patients fail to be aware of items to one side of space. Neglect is most prominent and long-lasting after damage to the right hemisphere of the human brain, particularly following a stroke. Such individuals with right-sided brain damage often fail to be aware of objects to their left, demonstrating neglect of leftward items. There can be subtle differences depending on where the damage occurs. For example, neglect on the left side of one's own body, or neglect on the left side of objects. Right-sided spatial neglect is rare because there is redundant processing of the right space by both the left and right cerebral hemispheres, whereas in most left-dominant brains, the left space is only processed by the right cerebral hemisphere. Hemispatial neglect is associated with hyperexcitability within the left cortex, and recent research has found that 2 weeks of transcranial magnetic stimulation treatment to the left hemisphere can accelerate recovery of hemispatial neglect.